maybe you can tell us a bit about why you chose orthopedics as opposed to all the other surgical specialties.
Yeah, totally. So, as I said, I really liked the tangibility of it. I liked the fact that, when you do something, you get post-op x-rays and you see exactly the work that you did. So that was one thing I really liked about it. Again, the engineering principles. I think one thing I didn't realize is how much of orthopedics you actually don't really learn about in medical school. Things like screw engineering or plate engineering, biomechanics, things like that, you don't even know that you don't know until you start an orthopedic residency. And then that sort of kind of the engineering principles was very interesting to me. I think the other thing is the sort of patients that you end up seeing. I really liked medicine, honestly, and there was this thought that you do deal with a lot of medical problems in general surgery, whether it's abdominal stuff or cardiovascular or vascular things like that. And so there's a draw towards that, but then I started seeing the kind of patients you end up taking care of. And one thing that really appealed to me about orthopedics is you give people a quality of life, not just quantity of life. And, you see the post-operative outcomes of a lot of general surgery patients, and certainly you end up saving a lot of their lives. But there's also, a lot of times these are really elderly people who are really sick, and the sort of satisfaction you see out of a person coming out of your OR through your clinic who's just better and thankful and now living a much more fulfilled life just seemed higher in orthopedics than in other surgical specialties. So that was part of it. And then last thing I think was that just the people, there's a certain kind of person that likes orthopedics, and it's not just the stereotypical jock kind of person. It's much more than that. I think there's something about orthopedics where, as I said, you can see the tangibility and the quality of your work afterwards when you look at a post-op x-ray of a fracture that you fixed, or a spine that you realigned, or what have you. There's also a exactness to orthopedics, which I loved. I mean, all surgery is, meticulous, but when you do a knee replacement, you're working in millimeters and you're working in, fractions of a few degrees, where you're trying to set someone up where their knee will last them, 10 years walking 10,000 steps a day for 10 years. And so there's an exactness to it that was really kind of appealing to me. And I think that's something that exists in a lot of orthopedists who have that sort of kind of meticulous mentality. It's also they're hard workers and they're good guys and they don't take themselves seriously. Guys and girls, sorry, who don't take themselves that seriously and have a lot of fun at work, which kind of seemed to appeal to me a lot too.